Introduction. Alcohol and painkillers are both commonly used substances, but they should never be taken together. Alcohol, a depressant, affects the central nervous system and can impair cognitive and motor functions. Painkillers, including over-the-counter options like acetaminophen and ibuprofen, as well as prescription opioids, are used to relieve pain but can have significant side effects. Mixing alcohol and painkillers can lead to serious health risks, including liver damage, gastrointestinal bleeding, and increased risk of overdose. Mechanism of interaction. The interaction between alcohol and painkillers varies depending on the type of painkiller. Acetaminophen. Acetaminophen is metabolized by the liver. When taken in recommended doses, it is generally safe. However, combining it with alcohol can overwhelm the liver, leading to toxic metabolites that cause liver damage. Both alcohol and acetaminophen deplete glutathione, a substance that helps detoxify the liver, exacerbating the risk of liver injury. NSAIDs, nonsteroidal anti-inflammatory drugs. Ibuprofen, aspirin, and naproxen are common NSAIDs. These drugs inhibit the production of prostaglandins, compounds that protect the stomach lining and help with blood clotting. Alcohol can irritate the stomach lining and also inhibit clotting, so when taken together, the risk of gastrointestinal bleeding and ulcers increases significantly. Opioids. Prescription painkillers like oxycodone, hydrocodone, and morphine are opioids. Both alcohol and opioids depress the central nervous system, which can result in enhanced sedation, respiratory depression, and an increased risk of overdose. Combining these substances can lead to fatal outcomes due to severe respiratory depression. Health risks. The combination of alcohol and painkillers can lead to numerous serious health risks. Liver damage. The most significant risk when combining alcohol with acetaminophen is severe liver damage, which can be fatal. This combination is a leading cause of acute liver failure. Gastrointestinal bleeding. The risk of stomach ulcers and gastrointestinal bleeding is greatly increased when alcohol is combined with NSAIDs. This can lead to serious complications, including perforated ulcers and severe blood loss. Increased risk of overdose. Opioids and alcohol both depress the central nervous system, which can result in extreme drowsiness, respiratory depression, and death. The risk of overdose is significantly heightened when these substances are combined. Impaired cognitive function. Both alcohol and painkillers can impair cognitive and motor functions. When taken together, these effects are amplified, leading to increased risk of accidents and injuries. Case studies and statistics. Numerous case studies and statistics highlight the dangers of combining alcohol and painkillers. According to the Centers for Disease Control and Prevention, CDC, alcohol is involved in about 22% of opioid overdose deaths. Additionally, a study published in the American Journal of Preventive Medicine found that people who mix alcohol and painkillers are more likely to engage in risky behaviors, such as driving under the influence. Emergency room data also supports the dangers of this combination. A report from the Substance Abuse and Mental Health Services Administration, SAMHSA, revealed that emergency room visits involving the combination of alcohol and prescription painkillers have increased significantly, underscoring the public health threat posed by this interaction. Regulatory and expert opinions. Health organizations and experts strongly advise against mixing alcohol with any form of painkillers. The FDA includes warnings on painkiller packaging regarding the risks of combining these medications with alcohol. Physicians and pharmacists frequently counsel patients on the dangers of this combination, emphasizing the importance of avoiding alcohol while taking pain medication. Experts in addiction medicine also highlight the increased risk of dependency and abuse when alcohol is mixed with opioids. This combination can lead to heightened euphoria, which can drive individuals to misuse and abuse both substances, increasing the likelihood of addiction and overdose. Preventive measures. To avoid the dangerous interactions between alcohol and painkillers, individuals should follow these preventive measures. Read labels and follow instructions. Always read medication labels and follow the prescribed dosage and instructions. Be aware of any warnings regarding alcohol consumption. Consult healthcare providers. Speak with a healthcare provider about the risks of combining alcohol with any prescribed or over-the-counter painkillers. Seek advice on safe pain management practices. Avoid alcohol when on painkillers. The safest approach is to avoid alcohol entirely when taking any form of painkiller, whether it is an over-the-counter medication or a prescription drug. Seek alternatives for pain relief. Consider non-pharmacological methods for pain relief, such as physical therapy, acupuncture, or other holistic approaches, especially if you consume alcohol regularly. Conclusion. In conclusion, mixing alcohol with painkillers is a dangerous practice that can lead to severe health complications, including liver damage, gastrointestinal bleeding, and increased risk of overdose. The interaction between these substances varies depending on the type of painkiller, but generally results in amplified negative effects on the body. Health experts and regulatory agencies strongly advise against this combination and recommend taking preventive measures to avoid potential risks. By understanding the dangers and following medical advice, individuals can ensure safer use of pain relief medications and maintain better overall health.